So there are several important reasons to treat gum recession. The number one reason is if the gum recession is progressive in nature. And one of the things we do during our examination is we look at the type of gum tissue that's present around the tooth, the thickness of it, the quality of it. We look at the position of the tooth within the dental arch. And we find out, and sometimes it takes some historical digging to find out if if the recession is progressive in nature. Because if people notice their tooth is getting longer over time, it is reflective of the fact that they are losing attachment around the tooth. The gum line gets its position based on where the bone is underneath. And so if someone comes and says, I've noticed my tooth getting longer, then that tells us that means they're losing potentially some bone around the tooth as well. There's various different ways to treat gum recession. In some cases, we can do very small incisions and move the gum tissue down. That's possible. In many cases, though, especially if the thickness needs to be changed, and oftentimes it's not just the level but also the thickness that will dictate not just how much root we can cover, but also how stable it will be in the long term. And so in this case, we offer the ability to harvest a little bit of tissue from the patient and move it from one part of the mouth to another. And there's various different ways of doing that. One is called a free gingival or free gum graft. Another one's called a connective tissue graft. And they have different indications, but both are similar in that the tissue that is harvested, the donor, is from the same person. So it's just moving it from one place to another. The main ways that we treat gum recession depends on the patient's needs and the patient's desires and the clinical situation.